In vitro fertilization, or IVF, is becoming more and more common among couples who cannot conceive children naturally. To retrieve eggs for the operation, doctors will grab an egg from the woman's uterus with a needle and then join it with the man's sperm in a culture dish. After the eggs and sperm are mixed together, the doctor inserts it back into the woman's uterus in hopes that it will form a baby. Many children that are born today are a success of IVF treatment. However, IVF does not always have a positive result. Some children have health complications and some others get medical conditions as a result of IVF treatments. IVF should be offered to couples who cannot conceive naturally, but the couples should be informed beforehand of the pros and cons to avoid conflict. IVF ultimately provides a way to have a baby for couples who cannot conceive naturally. In order to undergo IVF treatment, there are certain things the patient must do beforehand. Women only release one egg per menstrual cycle, so doctors supply them with an injectable hormone that allows for them to release multiple eggs. There are a few types of hormones, such as Clomid, Proronal, and a pregnancy hormone. The goal for doctors is to harvest as many eggs as they can so that they have a higher chance of conceiving. Once the eggs are harvested, the doctors will join the eggs and the male sperm in a dish. When the eggs and sperm are together, the doctor puts them back into the women in hopes that they will take. A few weeks after the transfer, the women will take a pregnancy test to find out whether the treatment worked. If the transfer worked, then the women will proceed with pregnancy normal and have the baby. Normally for couples, the pros of IVF outweigh the cons. The success rates are rising every year. In 2012, 2,000 more babies were born through IVF treatment than in 2011. Having a 2,000 baby increase in success rates in 1 year is a major outcome, and looking into the future, doctors only see the outcomes becoming more and more positive. Although there are more positive outcomes in IVF treatment, doctors say that women under 35 years old are the ones who have a higher success rate. Therefore, the women who want to have a baby through IVF that are older than 35 might have a harder time conceiving. Even though age may be a downfall on IVF treatment, doctors in different countries are having success with women of all ages. In Australia, around 41,000 treatments were performed, and out of the 41,000, about 10,000 babies were born. IVF is becoming more common for couples who cannot conceive. With the latest statistics and rises in success rates, IVF is the perfect way to conceive naturally. With every pro, there is always a con. Although IVF has several great outcomes, there are also some negative outcomes, such as higher blood pressure, body fat, vascular dysfunction, and glucose levels for the children. These defects make people think twice about going through IVF treatment. The cons do not only affect the children, but the mothers too. Some defects are ovarian hyperstimulation syndrome, ovarian cysts, menstrual irregularities, premature menopause, and ovarian cancer. These defects to the mother and child can cause a lot of complications and make people question whether IVF is worth it. Complications are not only dealing with the child's health, but also with switches and carriers. Two women were undergoing IVF treatment at the same time in the same clinic, and their embryos got switched. After 3 months of pregnancy, one of the women found out that she was not carrying her baby but the other woman's. It may seem crazy to some people to think that a thing like this could happen, but people need to understand that there is a potential for a mistake to be made if you go ahead with IVF treatment. IVF treatment is and never will be exactly perfect, so to go through with a treatment this serious, everyone needs to consider all the cons that come along with it. Even though there are many cons to IVF treatment, there are also plenty of positive things that come with it too. Conceiving naturally is a priority that many couples want, so before going through these strenuous procedures, they should be forewarned of the pros and cons. IVF treatment helps people to have babies naturally, but it also comes with some serious complications. There is a potential for defects to the mother and the baby after going through IVF treatment. While taking the side effects into consideration, IVF is still looked at as a great thing to allow for people to have a family of their own. IVF has several pros and cons, but the potential outcome of having a family outweighs most of the negative points and only brings forth positives.